Hi, my name is Catherine Cueva, and in this video, I will talk about the negative dietary cation and ion difference and its positive effect on the health of postpartum dairy cows. First, let's see what is happening to dairy cows during transition period. The demand of calcium in dairy cows significantly increases at the onset of lactation within a very short period. In transitional periods, that is 3 weeks before and after calving, metabolic disorders may occur due to dietary imbalance in dairy cows. Some factors, such as age, stage of lactation and parity, body condition, and diet, may influence imbalances. With this, it is tough for dairy cows to maintain their calcium homeostasis, especially with high-yielding dairy cows. At least 50% of multiparous cows are affected with subclinical hypocalcemia. Low calcium in the blood may progress to other metabolic diseases leading to poor health and poor performance. Setting up your dairy cows for relaxed calving and whole lactation starts with dry cow feeding and management decisions. A diet that ensures easy calving, higher milk production, regaining their energy balance, and getting back into calf for the next lactation. But how can we achieve this? In a study conducted by Cotto Serenjo et al. 2021, feeding a negative DCAD to transition cow will reduce metabolic diseases such as milk fever, clinical mastitis, and displaced abomasum. So what is negative DCAD? Strong cations and anions are present in cow's feed as charged particles. The DCAD includes two cations, potassium and sodium, and two anions, chloride and sulfur. DCAD can be adjusted by decreasing the cations, increasing the anions, or both. Adding more strong ions, the chloride and sulfur, will make the DCAD more negative, while higher cations give more positive DCAD. Increasing the amount of chloride and sulfur through acidogenic supplements to the cow's diet will lead to lower DCAD values. Negative DCAD creates metabolic acidosis due to high concentrations of chloride and sulfur. The blood pH will decrease slightly, and the urine pH will decrease drastically. When blood pH decreases, it will stimulate the parathyroid hormone. Parathyroid hormone will amplify the sensitivity of the tissues. For calcium regulation, there are two main organs that are involved and are reactive to PTH. These are bones and kidneys. PTH stimulates the breakdown of calcium in the bone, and this will increase the readily available calcium in the blood. Another effect of parathyroid hormone is increasing blood calcium. It stimulates the kidney to produce more of the activated form of vitamin D. The activated form of vitamin D stimulates gut tissue to absorb more calcium that is released from the bone tissue, and this absorbed calcium by the gut contributes to the readily available calcium pool. The significant reduction in urine pH caused the kidneys to excrete more calcium via the urine called hypercalciuria, and this contributes to the readily available calcium. The large demand for calcium begins in transition period with a huge amount of calcium is needed for colostrum and milk synthesis. This increases the amount of calcium directed to the mammary gland via the bloodstream to meet the demand of milk synthesis. If we could meet the demand of calcium requirements of the transition cows through the negative DCAD,
we could avoid the metabolic diseases such as milk fever, displaced abomasum, and clinical mastitis.
Milk fever or hypocalcemia are common metabolic diseases of dairy cows and can affect at least 50% of multiparous cows. Low blood calcium concentration can increase the risk of another postpartum disease. Displaced abomasum is also a common early lactation disease of dairy cows. It is also associated with hypocalcemia that may lead to the absence of abomasal motility and gas accumulation due to displacement. By using negative DCAD, the increased calcium may enhance movement in gastrointestinal and augment rumen fill, reducing risk factors associated with displaced abomasum. Clinical mastitis is a metabolic disease that affects the milk of dairy cows. An abnormal consistency of milk is visible, such as clots, flakes, watery, or bloody, that may or may not show swelling of the udder. Negative DCAD can enhance teat sphincter closure after milking. Optimizing the health of transition cows at postpartum has many advantages. Increased milk production, decreased culling rate, labor and time efficiency, avoid vet pills and reduce medication, low mortality, higher profitability, happy cows, and happy farmers. To summarize this video, the negative DCAD assists in optimizing the metabolism of calcium, leading to reduced metabolic diseases and high profitability.